This is Isla, and this is her mother, Natalie. Isla was diagnosed with epilepsy at the age of 2 and has been under the care of a consultant paediatrician and their team ever since. The clinical teams are very busy with lots of children to look after, and appointments are sometimes 4 to 6 months apart. Natalie used to wait from one appointment to the next to discuss any concerns with the doctors and had to make a list of things to ask about during their appointment. This long waiting time was a source of stress and worry for Natalie, who sometimes forgot to ask everything she needed to during the appointments. Epilepsy is a condition that requires continuous monitoring, but it is not always convenient to contact the doctors by phone, especially outside of working hours when seizures can occur. In the past, Natalie would leave messages on hospital answering machines, unsure if they had been received. When Patientsknowbest was introduced, Natalie was initially unsure of what it was about and how it could help, but since giving it a try, she has found it to be a brilliant solution. Patientsknowbest has taken away much of the stress and worry caused by the long waiting times between appointments. With Patientsknowbest, Natalie can send a message to the doctors and their secretaries, who will see the message and respond as soon as they can. This platform is especially useful for a carer of a child with epilepsy, since it allows Natalie to send messages detailing everything she saw, thought and felt at any time, even when she is in bed at night. It gives her time to think and detail the important bits of information they need to know. In the past, Natalie used to forget important details between appointments, but with Patientsknowbest she can send a message while everything is still fresh in her mind. Patientsknowbest has also allowed Natalie and the doctors to discuss and decide on medication increases via messaging when Isla has been through tricky periods with her seizures. In 2018, Isla had to be admitted as an emergency to a hospital which they were unfamiliar with, and doctors they had never seen before who knew nothing about Isla or her epilepsy. She was there for nearly a month, and if Patientsknowbest had been available to her at the time, Natalie could have easily contacted her usual doctor and kept them updated on Isla's situation. Overall, the main benefit of Patientsknowbest for Natalie is the ability to communicate with the doctors more easily, particularly during urgent situations. For more information, use the link on the screen.